I'm Lyndall from Vetster, and today we're talking about dog diarrhea, why it happens, what it means, and when you should be concerned. As usual, all of the information in this video has been carefully reviewed by leading vets to veterinarians. All right, let's hand it over to the experts.
Diarrhea is one of the top reasons dog owners visit the vet. It can happen for many reasons, some minor and some more serious. Most cases clear up on their own, but knowing when to monitor at home and when to get a vet involved is important. Dog diarrhea refers to loose, watery stools. It can be completely liquid or just softer than normal. Your dog might need to go more often, strain without passing much, or have mucus or blood in their stool. The color may be off, and some dogs also experience discomfort, appetite loss, drinking less water, gas, or loud stomach noises. Not all dogs will show every symptom, but if something seems off, it's worth paying attention to. Diarrhea is categorized by how long it lasts. Acute diarrhea lasts less than 48 hours and is usually not serious. Chronic diarrhea persists for at least 2 weeks and can indicate a more serious condition. The color and consistency of diarrhea can also provide clues. A small amount of red blood or mucus may not be a concern, but black, tarry stools or large amounts of bright red blood could indicate internal bleeding and require immediate veterinary care. Dogs love eating things they shouldn't. Table scraps, garbage, another pet's food, or spoiled food can all upset their stomachs. Most mild cases resolve on their own within a few days, but too much food or too many treats can also cause diarrhea. Dogs are naturally curious and may ingest toxic substances like medications, household cleaners, human foods, or yard treatments. If you suspect poisoning, don't wait for symptoms. Get to a vet immediately. Switching food too quickly can cause digestive upset. This doesn't mean the new food is bad, just that your dog's system needs time to adjust. A gradual transition is best. If your dog has a sensitive stomach, sudden changes are more likely to cause diarrhea. Like people, dogs can have food allergies or sensitivities. Food sensitivities usually cause itching and skin issues, but food allergies can lead to vomiting and diarrhea. These can develop at any age, leaving owners frustrated with constant diet changes. Diagnosing food allergies usually requires a long-term elimination diet under a vet's guidance. Bacterial and viral infections can all trigger diarrhea. These are most common in puppies and unvaccinated dogs. Serious illnesses like Parvovirus, distemper, canine coronavirus, and leptospirosis can all cause digestive issues. Many of these diseases can be prevented with routine vaccinations. Parvovirus is highly contagious and especially dangerous for puppies who aren't fully vaccinated. It causes severe vomiting and large amounts of liquid diarrhea, often with blood. Because parvo spreads easily and has a high fatality rate, early vaccination is critical. Following your vet's recommended vaccine schedule is the best way to protect your dog. Intestinal parasites are another possible cause of diarrhea. Healthy adult dogs may not show symptoms, but parasites like Giardia, Coccidia, tapeworms, hookworms, and roundworms can all lead to digestive issues. Puppies, dogs with weak immune systems, and those with severe infestations are more likely to experience diarrhea. The best way to prevent parasites is with year-round parasite control, which also protects against fleas, ticks, and heartworms. Regular fecal testing and deworming help keep parasites under control. Certain health conditions can also affect digestion and cause diarrhea. Some of the more common ones include pancreatitis, inflammatory bowel disease, hemorrhagic gastroenteritis, liver or kidney disease, endocrine disorders like Addison's disease, and even some types of cancer. If diarrhea happens frequently or comes with symptoms like vomiting, weight loss, or changes in energy levels, a vet visit is recommended. Pancreatitis is a common cause of sudden diarrhea, especially around the holidays when dogs get extra table scraps like turkey trimmings and gravy. High-fat foods can trigger a serious reaction that leads to an upset stomach and more severe health issues. Routine vet visits and testing help catch health problems early, making treatment easier and more effective. Older dogs need more frequent checkups since they are more prone to chronic conditions like kidney and liver disease. Most dogs tolerate medications well, but mild diarrhea can sometimes be a side effect. If your dog starts having diarrhea while on medication, check with a vet before making any changes. An online vet can provide quick advice on whether the medication is the cause and what to do next. If a dog develops diarrhea after starting a new medication, the timing might just be a coincidence. Something else could be causing the upset stomach. Always check with a vet before stopping any medication. Most mild cases of diarrhea clear up on their own in a day or two, but some situations require veterinary care. If diarrhea lasts more than 24 hours, comes with other symptoms like lethargy, vomiting, or appetite loss, or if your dog has an existing health condition, it's best to talk to a vet. Puppies, senior dogs, and immunocompromised dogs are more vulnerable and should be seen sooner. Puppies, unvaccinated dogs, and those with weak immune systems are at a higher risk of catching infections like Parvovirus and distemper, which can cause severe diarrhea. Small dogs and puppies can become dehydrated quickly, even if the cause of diarrhea isn't serious. In those cases, medical care might be needed to keep them hydrated and stable. Some cases of diarrhea are emergencies. If your dog suddenly starts passing jelly-like blood clots, has a large amount of red blood in their stool, or if the diarrhea looks black and tarry, get to a vet immediately. Other severe symptoms, like difficulty breathing, pale gums, or collapse, are also signs of an emergency. If you think your dog ate something toxic, don't wait. Seek emergency care right away. Mild diarrhea in healthy dogs often resolves on its own, so home remedies aren't always necessary. A vet might suggest fasting, switching to a bland diet like boiled chicken and rice, or adding fiber with canned pumpkin or supplements. However, not every case responds the same way, and some home treatments can make things worse. Always check with a vet before trying anything new. Never give your dog human medications unless directed by a vet, as they can be dangerous. Vets treat diarrhea based on the underlying cause, your dog's medical history, and other symptoms. For mild cases, treatment may include fasting, a bland diet, fiber supplements, probiotics, or fluids to prevent dehydration. If diarrhea doesn't improve, or if other symptoms appear, a vet may recommend further testing, such as blood work, fecal tests, urinalysis, or imaging. If test results seem confusing, a vet or vet technician can explain what they mean and what the next steps should be. A little blood and diarrhea from straining isn't always an emergency, but large amounts of red blood, black tarry stools, or blood clots require immediate care. Puppies with bloody diarrhea need to be seen by a vet as soon as possible, even if they seem otherwise fine. While diarrhea isn't always preventable, there are steps you can take to reduce the risk. Keeping tempting but unsafe items like table scraps, garbage, medications, and household cleaners out of reach can help. Staying up to date on vaccines and parasite prevention is also important, as many infections that cause diarrhea can be avoided with proper preventative. If your dog has mild diarrhea and you're not sure what to do next, an online vet can help you figure out whether you need to see a vet in person or if you can manage it at home. Dog diarrhea is common, and in many cases, it clears up on its own. But if it's severe, lasts more than a couple of days, contains a lot of blood, or comes with symptoms like vomiting or lethargy, professional advice is best. Puppies, senior dogs, and dogs with health conditions are more vulnerable and should be seen sooner rather than later. If you're ever unsure, a Vetster Vet is available on demand to help you figure out the best next steps for your dog, all from the comfort of home. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell so you never miss future pet health tips. See you next time.